Talking about the psychotherapies that are being used these days, we'll be talking about even the newer techniques that are being devised, and then we have the biomedical therapies that are being devised these days. So, psychotherapies, how do you basically go about and define a psychotherapy? It's basically when you treat a mental disorder by the counseling sessions. This is when you call it a psychotherapy, not by the use of the pharmacological drugs, and it's just by the cognitive techniques, and it can be just by the counseling sessions that are carried out between the patient and the doctor. So this is basically known as the psychotherapy, and that is what we're going to discuss today. So the key features of the psychotherapy are basically when the doctor and the patients talk to each other. This is basically a catharsis that is provided to the patient, and that is how basically he promotes what he's thinking about, what is the thought content, and what is the thought form of the individual. So this is how the doctor basically detects the abnormalities in the thought form and the thought content, and then he or she starts off with the psychotherapeutic techniques. So these are the key features of the psychotherapy or the behavioral therapies or the biomedical therapies that are being used these days. So we'll be discussing the key features of the treatment in the past. How was the treatment carried out in the past? This will be discussed over here in this section, and then we'll move on to the psychotherapies and the differentiation from the biomedical therapies that are being devised these days. So the key features of the psychotherapy, they basically include the listening and the talking that is being carried out between the patient and the doctor, of course. The release of emotion, it's basically providing the cathartic promotion platform for the patient as well. And then we have basically the giving out of the information by the patient that we're going to focus on. What kind of delusions or hallucinations he's suffering from? Is the patient suffering from any sorts of phobias or any kind of affective disorders? That is going to be highlighted over here. Then we're going to provide a rationale for the behavior. So if there is a particular kind of a behavior that is observed in a patient, there has to be a rationale in the thoughts and the thought form of that individual as well. So that has to be established by the psychiatrist. Then the restoration of the morale and the suggestions, and then we'll move on to the guidances and the advice that is given off to the patient. The therapeutic relationship is being developed in the by the doctor with the patient. So the doctor-patient rapport again is very important and very significant for the development of the cognitive behavioral therapy that we're going to devise on that particular patient. Now, when we talk about the key features of these counseling sessions, the key point that is the highlight of this psychotherapy is the self-motivation. So if the patient is motivated enough, he or she can excel in the cognitive behavioral therapies that we're going to talk about. Then the self-esteem of the patient is again very important. Love and belonging. So giving the patient the sense of love and belonging is basically going to raise the self-esteem of the individual, and he's going to be motivated automatically. So the safety and security of the individual is again very important, and then the physiological needs of the individual. So as a human, all of the physiological needs have to be catered for when you're talking about the cognitive behavioral therapies. So treatment in the past, what happened in the past was that the mentally ill people were confined to asylums in the mid-1500s. The treatment was quite harsh and often damaging for the patient. The Philip Pinel, famous for demanding and that mentally ill be treated with kindness, unlocking chains of inmates in France. So these were the developments that carried out, and how basically the treatment devised was quite differentiated from the newer techniques. Nowadays, the mentally ill patients are not treated as taboos. It's a common issue. People are being more aware of the psychological ailments that are quite common nowadays, ranging from depression, anxiety, and they can come up to the psychiatrist and get treated in well off before time, well off before the disease gets severe and it starts hindering the daily life activities of the individual. So, the NES training in the generic supervision competences for the psychological therapies, it basically includes the clinical psychology specialist supervision module for new supervisors, and it's basically including the clinical psychology refresher module for the experienced supervisors. Then we have the mindfulness supervision module, and then we can move on to the CBT specialist supervision module, and then there is another module which is known as the interpersonal therapy specialist module. So these are the different modules or the different treatment techniques that are being devised nowadays, and that basically differs from the techniques which were used in the past. So the treatment methods are aimed at making people feel better and they function more effectively with the passage of time. The two broad categories are type 1, which basically consists of primarily the psychological theories and the techniques. And then we have the other type that uses the medical interventions to bring symptoms under control. So these are the different types of the therapies that are being used nowadays, and that obviously includes the counseling sessions. Then we have these psychotherapies, the therapy for mental disorders in which a person with a problem talks with a psychological professional. That is usually a clinical psychiatrist that we're talking about, or even it can be a psychologist that we talk about. So the insight therapies, that includes the psychotherapies in which the main goal is helping people to gain insight with respect to behavior, thoughts, and feelings. And then we have the action therapies, that is the psychotherapy in which the main goal is to change the disordered or the inappropriate behavior directly. Then we have the biomedical therapies. Now, the therapy for the mental disorders in which a person with a problem is treated with biological or medical methods to relieve symptoms. So we don't have that clinical psychiatrist who's counseling, who's giving the counseling sessions over here in the biomedical techniques. We have the biological or medical methods instead to relieve the symptoms. The physical or the medical treatments are given, and it can be the pharmacological techniques are even devised for the improvement in the individual's thought forms and thought contents. And then we can have the examples of the drug therapies, and then we can have the examples of the ECTs, that is the electroconvulsive therapies or the electroshock therapies, and they have significant results on the patient's outcomes. Then we have the surgeries, for example, the lobotomies. They are sometimes carried out for the affective disorders or the mood disorders in very severe cases. To treat the mental or the psychological disorders, the modern health treatment is devised. That includes the drug therapies. Then we have the antidepressants, the mood stabilizers, antipsychotics, etc. are given for such mood stabilization or the depressive episodes in the individual. So in this section, basically, we gave an overview regarding the psychotherapies and the newer biomedical techniques for the treatment of the mental disorders. So that is the end of this section. Thank you for watching sqadia.com.